I'm the Executive Director of the Canadian Society for International Health, and I've been the Executive Director since 1998. And I took a leave in the year 2007 for a year to go to the International Organization for Migration. CSIH is a non-government organization whose focus is to strengthen health systems with an equity focus. We see ourselves as one of the Canadian voices in global health, and our niche is focusing on health system strengthening and regional district planning and capacity building. I appreciate that, and I don't know whether it's because I had trouble reading and was a bit dyslexic as a child, but I really appreciate pictures. And also because we work in so many different countries, sometimes a diagram or a picture that represents a concept has been very useful. So we work a lot with diagrams and pictures, and for me personally it just helps express things, I find. So we have a picture that you're going to see that represents CSIH's approach to health system strengthening, but it's also a picture of what the health system really looks like and the systems around that strengthen health. So the very top, kind of the roof that you're going to see there, is the vision and values of equity and accountability, and we believe that should be the umbrella for anybody approaching health system strengthening. First of all, the vision of accountability, because we have to be accountable back to the system, but more importantly the vision of equity or fairness, or a fair distribution of not just health but the resources for health. The social determinants will never be equal, but we can seek a fairer distribution. There's two pillars on either side of that diagram. One is social determinants and the other is health in all policies. The pillar of social determinants, many of you are familiar with. It's education, it's poverty, it's gender, it's all the things that we know determine health, or the upstream issues that have an impact on health. And we need to be aware of those as we're working in the health system, because we have to work with those other sectors. And we know that literacy has an impact on health, we know gender has an impact on health, and unless we address those, the work we're doing within the health system may not be effective. The second pillar on the right side is the health in all policies. And we used to talk about healthy public policies, or public policies for health. And what we mean by that is that we need to look at those policies, first of all, to make sure that they're health promoting, that if we have an industrial policy, it's not going to cause pollution that's going to cause ill health, or taxation policy, but also we know that the advances in health, whether it's in Canada or around the world, have been made by working with the other sectors. So in Canada, we're really familiar with our tobacco strategy. Well, that maybe had leadership through Ministry of Health, but the people that made the difference around the strategy were agriculture, customs, excise, sports, etc. And when you're working in low-income countries, you have to be aware of the infrastructure, the roads, the schools, the bridges, because if a road is being built by one sector here and the primary care centers are over here, then we've kind of missed the boat. You may need a boat to get to the primary care center. So, and we often say that a good road is a better predictor of maternal mortality than a doctor at the end of it. What good is a doctor if you can't get from A to B? So it's very important to be aware of those other sectors, their plans, their policies, and to learn to work with those other sectors as you're starting to develop an initiative. So I'm going to move down. Obviously, stewardship and leadership are important. What's going to be for the future, thinking longer term. Sometimes that's difficult in our country. It's more difficult in other countries in resource-strapped environments. The next two boxes, health and human resources, and health financing and resource allocation. You've probably heard a lot about the lack of human resources for health in many resource-poor countries. It's not that they're not training people in most cases. It's because the people get trained and then they move. They may move to another part of the region. They may move to Europe. They may move to Canada. They may move back to their country. But there's push and pull factors of why people leave and come back. And in the health area, there's just a massive deficit of absorptive capacity of the human resources, doctors, nurses, allied health professionals, etc. So this is extremely key to a sustainable health system. And how people are recruited, ethically or not ethically, what are our policies in Canada around that? There's a World Health resolution on ethical recruitment. These are all issues we need to be aware of when we're looking at why is it that a vertical program isn't working? An HIV program, an antiretroviral therapy, a DOTS program. Well, maybe because there aren't people that have been trained or they've left and there's nobody there to absorb the money and the demand and to deliver the services. The same goes with health financing and resource allocation. Most countries have been decentralized in their social sector, health and education, and many countries are decentralized almost overnight. So the capacity is pretty well non-existent to do the planning and the thinking, the evidence-based planning, to make the decisions that are equitable for resources, including human resources. So one of the things that we do is we help build the capacity at that district level, and we help them become familiar with their information. They may not even be aware of the information they have. A lot of the UN organizations collect information regularly, but it goes up to their national office, and they don't think they can own that information. So they have their regular reporting data that goes up to the Ministry of Health, but then there's all this other wonderful data on gender and social determinants from UNFPA, UNDP, all the UN organizations, and they can use that for their planning. So we help them understand what their resources are for making evidence-based decision-making, equity-based decisions for financing and resource allocation. And that really, I'm going to pop down to the box on health information systems or data for decision making. This is a really essential, pivotal piece in terms of the system, because health information systems informs the planning, it informs the policy. You want evidence-based planning, evidence-based policies, and without good information systems, we'll not know what's going on. And the funding for information systems tends to be non-existent. In any large bilateral project, there's not money that's earmarked to build or strengthen the information system. It's almost like an afterthought, and it's hard to kind of insert it into many of these projects. One of the big gaps in most low and middle income countries is the funding for research that's important to them in their country. We call it the 1090 gap, that there's this gap between the need, the research priorities in that country, and the amount of money that's going to those research priorities. That's one thing, the resources. The other is who's trained to do research, and how many people are trained to do that research, and what's the capacity, and how is that rolling out in the countries so that you can gather the evidence. So that's an important piece. And then we move down to evidence-based, clinical, and community-based decision-making. So you've got information, data, but it may not be data for decision making. It may not be translated into information that you can use. And this is a big gap in many countries in terms of the evidence and using the evidence for clinical decision making or community-based programming. And that link back and forth is a culture that we've built here in North America and Europe, but isn't necessarily a culture, and thus the decisions may not be cost effective. They may not be based on evidence that somebody comes back and says, well, that worked, and they talk to somebody else and they try it out. And we know that's not the way to build sustainable decision making at the clinical and community-based level. So that's another piece that we have to really consider and look at. And finally, the two little lower boxes are really what often people think is the care, is the system. And this is the care system, or the illness care system, which is the service delivery, treatments and programs, and community-based interventions and health promotion. So those two little boxes down at the bottom are the care part of what's a much broader health system, right? And then the systems for health are the other issues around health and all policies. Now the two pieces, the two foundation pieces, One is a strong and vibrant civil society. We don't know how lucky we are here in Canada that we can speak up, we don't get put in jail, we can criticize the government, and in the past we've actually been paid by the government, we get grants to be advocates. Now the climate right now may not be so conducive to that, but we still have the right to stand up and say this is wrong. People still believe they can stand up and ask for accountability. And if you have a strong and vibrant civil society, you can keep the government's feet to the fire. And that then falls into the next foundation piece, which is this transparent and accountable public sector. That won't happen unless you've got a healthy civil society and public debate and dialogue. So that's really the big picture. And you've got this, looks like the Parthenon, but it really is, we feel it works, this diagram. It helps people tell the story about what is a health system. And each one of those little building blocks has to be in place. And if some of them aren't there, that's why you're seeing that systems are not moving and why they're failing. And is why the Global Alliance for Vaccines, the Global Fund for HIV, AIDS, TB, and Malaria, when they were putting big money into delivering of the silo program, and then realized, wait a minute, these silos are like going into quicksand. We need a system. We need to build the system. So now they're investing in health system strengthening as well, because they realize there has to be a foundation onto which these programs will sit, and also, as Minister Oda spoke today, integration of those services.